Hello, my name is Peter Walker-Birch and I'm here again with the second video podcast instalment for Clinical Placement 1. Firstly, can I congratulate all of you on completing your first week in clinical placement. I hope that you have all had a good experience during this first week. If you want to, please feel free to drop me a line or a tweet to tell me all about how your first week has gone. I suspect many of you will have enjoyed the rest of the weekend, as clinical practice can be very tiring, especially in the first few weeks when you are adjusting to working with new people, the new environment, starting to x-ray real patients, etc. I hope you are all enjoying this exciting and challenging experience though. I hope that you like the Star Wars theme that opened this video podcast. The choice was very deliberate, as Harrison Ford has been in the news this week after breaking his ankle on the set of the new Star Wars film. Have any of you x-rayed any ankles yet? Perhaps, whilst you've been working in the accident emergency department. The reason for mentioning ankles is that I released on Monday, as promised, some radiographic anatomy images for you to look at. These images are designed to help you revise your radiographic anatomy for a range of typical examinations, including the ankle. By the end of the placement, you should be able to accurately and confidently articulate this radiographic anatomy from memory. I will put up the answers for these images at the end of the week. Whilst we are talking of ankles, I was bitten last week by some invisible insects and ended up with cellulitis in my ankle. As you can see, this has not been a very pleasant experience. You may have come across a few patients in your hospital with cellulitis. It is a very painful condition, take it from me, and care should be taken when positioning these patients. Anyway, the good news is I've just finished 2 courses of antibiotics and most of the swelling is now gone. I'm now able to walk properly again. It was just a shame I couldn't go bowling with my son on his 7th birthday. Oh well, celebrate. Have any of you started to look at the activities in the module guide that were planned for you all whilst you were out on placement? In the first 2 weeks of placement, it was suggested that you draw a large A3 map of your department, excluding MRI, ultrasound and reporting rooms. The idea was to get you familiar with your department and to note down where the ionising radiation equipment is on the map, including any film processors, CR plate readers and radiation protection equipment, like lead equivalent aprons and gonad shields. If you look at the module guide, it gives you some information to collect, such as the make, model and age of the equipment, as well as things like filtration, tabletop material, and maximum and minimum exposure factors. In fact, why don't you send me a copy of your diagram and we can put them in a gallery on the Blackboard site. I know that some of you have already got your bipartite sessions planned with your clinical mentors. You normally have your first bipartite at around week 4, when your mentor will meet with you to complete a formative feedback sheet. The bipartite allows your mentor to provide constructed feedback on your progress so far. This process will help to identify any areas where you may not be achieving the placement outcomes, thus acting as a sort of formative assessment. The form may be used to develop your personal objectives or an action plan that will enable you to meet the placement objectives by the end of the placement. Remember, there's a wide range of things that you can use to evidence your progress. Take a look at page 35-36 of the clinical documentation that's available on the MSc Blackboard site. If you have any queries, just drop me an email message or a tweet. Your visiting lecturer, who is also your personal tutor, should be contacting your base hospital to arrange a visit to see you. The idea behind these visits is to touch base with you all and to see how you're all getting on in placement. If there are any issues or problems, your visiting lecturer can help to determine the best way to overcome these problems. Your visiting lecturer is also interested in how your portfolios are progressing. Remember, as part of the programme, you are required to develop a clinical portfolio. The portfolio will enable you to assess your current level of knowledge and skills and help you to identify your personal development needs. To do this, it is necessary to accumulate evidence that you will include in your portfolio. Your visiting lecturer will be happy to quickly read through your portfolios and make comments or suggestions, so please remember to bring your portfolios along with you. I also wanted to bring to your attention a video that I came across on Twitter this week by the inspirational Kate Granger, the creator of the Hello My Name Is campaign. You should all remember this campaign, as we had some selfies taken at the start of the module to show your support for this very important campaign. As you can see, these selfies ended up on Twitter and the Society and College of Radiographers website. This video really drives home the importance of the campaign and the little things that you, as a student radiographer, can do to improve the experiences of your patients whilst they're in your care. The video is half an hour long, but it is well worth the watch. I'll put a link up on the Blackboard site for you. As you can see from the following picture, I received my Hello My Name Is badge in the post on Friday. I shall be wearing it wherever I go now. Finally, I just wanted to bring you some breaking news. 4 of our MSc students from cohort 2012 had their MSc dissertation posters accepted for the International Society of Radiographers and Radiological Technologists. They have a congress which is held in Helsinki in Finland, which happened this weekend. The event takes place every 2 years, and 86 poster entries were received for this event this year. And I'm pleased to tell you that 2 of our students, Rebecca Krantz and Harry Hopkinson, have won first and third prize respectively. This is fantastic news and a great testament to the work of Dr. Phil Cosson and the quality of the research work that our MSc students carry out. I hope that you will feel inspired by their success. Well, that's all for this week. I hope that you have a great second week in placement. Take care. Bye-bye.